Ladies and gentlemen, welcome to the QT Faculty of Law for today's conference on intellectual property and education in the age of COVID. As is always the case, we'd like to acknowledge the traditional owners, and in keeping with the spirit of reconciliation, we acknowledge the traditional owners of the lands where QT now stands and recognise that these have always been places of teaching and learning, and we wish to pay respect to their elders, past, present and emerging, and acknowledge the important role Aboriginal and Torres Strait Islander people continue to play within the QT community. And in the context of debates around intellectual property and education, there has been very significant discussion about the importance of Indigenous intellectual property. Today's event is going to look at some of the relationships and connections and intersections between intellectual property and education. It will cover many different species of intellectual property, spanning copyright law, trademark law, patent law, trade secrets, and questions of licensing. In many ways, the conference today is also going to span an array of different disciplines within education, everything from the creative industries to medicine and biotechnology and even clean technology. In addition, this event is also going to focus upon open licensing within the educational institutions. So the use of open licensing to promote open access, open innovation and open data is also a very kind of important dimension in terms of the debate and discussion over intellectual property and education. This event is also going to focus upon the role of universities and educational institutions and research organisations in responding to the coronavirus COVID-19 public health crisis. So universities and research institutions have a very particular special role to play as keystones in the knowledge infrastructure. They are generating a whole wide range of technologies that could be of use in tackling the coronavirus crisis, including vaccines, treatments and diagnostics, as well as a range of other public policy solutions. So this event, amongst other things, is going to think about ways and means in which we can encourage public transfer of some of those research and public policy solutions. Finally, this event is also going to be an Australian launch for this research handbook on intellectual property and technology transfer, edited by Professor Jacob Rooksbury from Gonzaga Law School. This collection provides a comparative analysis of how an array of different countries manage intellectual property and technology transfer from educational institutions, and also kind of includes a contribution by myself looking at intellectual property and higher education and 3D printing. So welcome everyone. I hope you enjoy today's range of presentations looking at different aspects of intellectual property and education. Thank you. Our last speaker in the session on patent law and education is Dr. Mohammed Zaheer Abbas, who is an expert in intellectual property, access to essential medicines and sustainable development. Unfortunately, we haven't had an opportunity yet to congratulate Mohammed on the passage of his PhD thesis on Indian patent law and opposition proceedings and access to essential medicines. So we should use this moment to acknowledge his achievement in passing his PhD with some very rigorous world experts on access to essential medicines. Dr. Mohammed Zaheer Abbas is expanding his research of late to look at intellectual property, access to essential medicines and the coronavirus. He's recently published a paper on Costa Rica's proposal for the creation of a global pooling mechanism. And today he's going to be expanding upon some of that work, looking at harnessing the potential of 3D printing to develop emergency equipment in response to COVID-19.
First of all, thank you, Professor Matthew, for having me and for providing me this opportunity. I'm Muhammad Abbas from Pakistan. I'm an independent legal researcher. I have recently completed my PhD in law at Queensland University of Technology. Today, the topic of my presentation is harnessing the potential of 3D printing to develop emergency equipment in response to COVID-19. Today, we will cover supply chain disruptions during COVID-19 crisis, 3D printing and its unique benefits, potential uses of 3D printing in response to COVID-19, patent exclusivities, and compulsory licensing as a safeguard mechanism to deal with the issues of access. The COVID-19 crisis has caused serious supply chain disruptions. Sustainability of health systems hinges on health, safety, and well-being of frontline healthcare workers and reliable supply of emergency medical equipment for patients as well as for providers. Global healthcare system is under critical strain due to severe shortages of critical medical products, especially personal protective equipment, PPEs. The COVID crisis has put a spotlight on the importance of 3D printing, which has the potential to scale up production in a time and cost-efficient manner. First of all, what is 3D printing and what are its unique benefits? 3D printing is a process of making three-dimensional physical or solid objects from pre-designed digital models. The 3D technology can be described in the two simple steps. Number one, the blueprint of the product, also called computer-aided design or CAD file, is created using a 3D modeling software that the softwares are available online free of cost. Second, the CAD file is sent to the 3D printer that creates physical objects by forming layers of filament on top of each other. 3D printing, it's important to discuss why 3D printing is such an important technology in response to COVID-19. What are its unique features? Number one, cost effectiveness. The traditional manufacturing methods like cutting shapes out of a block of material, adding material piecemeal to build up shapes, and forming material that is liquid or plastic, then letting it set. These are traditional manufacturing methods. They have their infrastructure needs. 3D printing is cost effective because it does away with these infrastructural needs like numerically controlled cutting machines, molds, dies, and casting tools. 3D printing is also cost effective because it uses less material as compared to traditional manufacturing technologies, because it does not involve carving out an object from a piece of metal or plastic. And the commercial cost of 3D printer is declining. Now some of the 3D printers, they are available as cheap as a few $100 US. So even common citizens, they can afford to buy 3D printers. Time effectiveness, the 3D printing industry is also called rapid prototyping industry because one-offs can be made much more easily and quickly. 3D printing technology provides you the flexibility to design anything and print it right away in one go. A product can quickly go from an idea to design to manufacturing in a single day. On the other hand, the traditional manufacturing methods, they lack this ability to adapt quickly, and the same process can take several days or even weeks for traditional manufacturers. Number three, localized manufacturing. A 3D printer serves as a factory in a box and enables localized production without requiring complex tooling and assembling procedures. 3D printing requires neither a large production facility nor a large knowledge base or expertise in manufacturing engineering. Hospitals and medical centers may use their own 3D printers to reduce the time and cost of making the health products available. 3D printing enables a distributed manufacturing strategy, which this strategy means making or manufacturing the products closer to the point of use. And this strategy allows rapid delivery of health products without wasting any time and resources on transportation. Interstate and cross-country transportation has itself been impacted negatively by the COVID crisis, so this is important distributed manufacturing strategy. Improved collaboration, 3D printers enable global collaboration and avoid duplication of effort because the CAD files can be shared online by using one of these websites like Thingiverse, Shapeways, Uimagine, Cubify, My Mini Factory. So when these files are shared, they are accessible globally. Anyone in any part of the world can benefit from the innovative works of the 3D innovators. And they can not only benefit from their work, they can build upon and refine their innovation and make new files available on these forums. So it makes it possible to collaborate globally. These websites should add a special section where hospitals and medical practitioners, they should be able to communicate their needs so that 3D innovators can respond to their specific needs in a time-efficient manner. Uses of 3D printing in response to COVID-19. The COVID-19 crisis has increased the visibility of the 3D printing industry. 3D printing has the value in providing cost and time-efficient solutions in times of supply chain disruptions. Because of its unique features, 3D printing bridges the manufacturing industry and healthcare industry because it has the ability to bring customized products in a time and cost-efficient manner. In the subsequent slides, I will discuss some of the notable uses of 3D printing in response to COVID-19. Number one, connectors or splitters for ventilators. Ventilator connectors or splitters are used to increase the capacity of ventilators. The connectors can be 3D printed to expand the use of a single ventilator to serve 2 or 4 patients. So this is very important because there are severe shortages of ventilators, especially in the less resourceful countries in Asia and Africa. Number two, custom-made face masks. Customized face masks which fit better are both safer and more comfortable as compared to one-size-fits-all masks. And the comfort here refers to both the comfort of the wearer's face and the comfort of the breathing process. Customized face masks can be easily developed by combining 3D facial scan features of advanced smartphones and 3D printing technology. 3D modeling of individual facial scans can easily be done by CAD designers by using freely available 3D modeling software tools. And the process is not complex and it takes less than 10 minutes according to a study. Splash-proof protective face shields. COVID-19 virus spreads through respiratory droplets caused by coughing or sneezing. Face shields prevent infected respiratory droplets from entering healthcare workers' nose and eyes. Face shields can help prevent contamination of N95 masks and prolong their use. This is also important because there were severe shortages of N95 masks during the peak pandemic situation. One of the global 3D manufacturing firms, Stratasys, is not only producing face shields but also facilitating others to do the same by keeping the design and instructions in the public domain. And according to a study by Amin and others, 3D printing one face shield, it costs only $7.30. So that's not very expensive. Number four, air purifying respiratory hoods. They are important for health professionals to protect them against airborne viral particles, and they can be 3D printed. Number five, point of care testing. As noted by Director General World Health Organization that a critical component of response to COVID-19 is to test, and test. Countries need tens of millions of nasal swabs or diagnostic swabs if they are going to test enough people for COVID-19. Farm Labs in the US is using 250 3D printers to make 100,000 diagnostic swabs per day. So this is a huge contribution from the 3D printing industry. Number six, ear guards are mask relievers. Healthcare workers struggle to remain comfortable wearing face masks for extended periods of time. In Canada, a 13-year-old boy scout Squint's calendar made headlines with his innovative 3D printed ear guards or mask relievers. These ear guards help mitigate the nagging issues by taking the pressure off healthcare workers. And this little boy, Quinn Calendar, he is keeping the design in the public domain so that anyone in any part of the world they can benefit. So thumbs up to the little Quinn Calendar. Number 7, hands-free door openers. 3D printed hands-free door openers mitigate the risk of transmission by making it possible to open doors with an elbow in order to avoid direct skin to surface contact. So prevention is better than cure. Patent exclusivities. 3D printing technology, because of its unique features, has caused some regulatory issues and legal debates. There are serious issues, complex issues of liability resulting from direct, indirect, and contributory infringement. The conventional patent laws, which normally have the physical attribution to innovation, they do not provide clarity on whether the infringement will be assessed based on CAD file or the 3D printed product, what will be the liability of websites like Thingiverse, Shapeways, which contribute towards infringement. So these are issues, complex issues, still being dealt by policymakers. But one thing is clear, that the rights of patent holders include the right to prevent others from making, using, selling, or distributing the patented products. So patent exclusivities, they do pose a barrier towards achieving the maximum potential of 3D printing in response to COVID-19. For example, in Italy, when a public-spirited duo redesigned and 3D printed walls for ventilators, and they did it for the sake of humanity, they were threatened by patentees because they had violated their patents. Compulsory licensing as a safeguard mechanism. Patent exclusivities should not hinder government's effort to provide life-saving drugs and medical devices to its citizens. A government may compulsorily issue a license to a third party, allowing them to produce generic copies of the patented product. The government is, however, required to pay fair compensation or royalty to the patent holder. The World Trade Organization TRIPS agreement does not use the term compulsory licensing, but it stipulates a set of conditions under Article 31 for grant of a non-voluntary license or other use without authorization of the right holder. Paragraph 5b of the Doha Declaration 2001 confirmed that each member has the right to grant compulsory licenses and the freedom to determine the grounds upon which such licenses are granted. Paragraph 5c of the Doha Declaration further clarified that public health crises related to HIV/AIDS, malaria, TB, and other epidemics can be a justifiable ground for the grant of compulsory licenses. So there is a lot of clarity that compulsory licensing is a legitimate option to deal with the issues of access to the needed health technologies. But practically, compulsory licensing has been a contentious issue. The ability of member states to use compulsory licensing flexibility has been seriously constrained. Almost every time a member decided to issue a compulsory license, it faced pressure from multinational pharmaceutical companies and economically advanced countries like especially the US. And it happened in 1998, 2002, 2006, 2007, and 2013 in case of South Africa, South Korea, Philippines, Thailand, and India respectively. Lately, until the start of the COVID-19 crisis, compulsory licensing had been a dormant policy option. Even in leading developing countries like India, China, and Brazil, they were not using this option. But with the start of the COVID-19, things have started to change. The COVID-19 crisis is bridging the north-south divide on the issue of compulsory licensing, because there is an increasing awareness that compulsory licensing is an important policy tool, not only for the developing and least developed world, but also for the economically advanced countries. And countries like Canada, France, Germany, they have recently made changes in their patent laws to facilitate the use of compulsory licensing. And Israel has actually issued a compulsory license for Calitra. Okay, let's conclude this discussion. Because of its unique features, 3D printing technology is best suited to scale up production of medical products in response to COVID-19. As we discussed, that it is time efficient, it is cost efficient, it enables localized production, and it enables global collaboration, and the global community and the global population can benefit from the innovations of a 3D innovator in one part of the world, and they can build upon their innovation for the sake of humanity. It is important for WTO member states to ensure that enforcement of patent laws does not become a barrier in achieving the maximum potential of 3D printing. As we discussed, that patent exclusivities, they do pose a threat, they do pose a barrier in achieving the maximum potential of 3D printing, as it happened in the case of Italy. And the safeguard mechanism of compulsory licensing, though it has been controversial previously, good things are happening, and there is increased acceptability towards compulsory licensing in the with the start of the COVID-19 crisis. So WTO member states need to make full use of compulsory licensing safeguard, because human lives are more important than private interests of patentees. And one thing is, I want to clarify that the global norms of intellectual property, they are from the WTO, from the World Trade Organization and the TRIPS agreement. The countries are not bound to follow the US model of patent law. So if US has problems with compulsory licensing, still countries have a legitimate right to use this safeguard for the sake of their citizens to enhance access to the needed health technologies. Thank you so much.